Hello, I'm Dr. Sweety Chandalia. I'm an ophthalmologist and a medical retina specialist working in Mumbai. Today I'm here to address a few questions like why a diabetic patient must have an eye checkup and when should they undergo these eye checkups. Now, often patients tell us, we are fine, we have no symptoms in our eye, we have no pain, no redness, we have already undergone a cataract surgery, we are seeing fine, so why do we still need these eye examinations? So now to address this question, let's understand that diabetes not only causes early cataract, but it can also affect other parts of our eye like the retina. Retina is a light-sensitive layer in the back of the eye which converts light which enters our eye into electrical signals, sends them to our brain, and this is how we see. And diabetes causes damage to the small blood vessels in this layer of the eye, causing retinopathy. So in retinopathy, the blood vessels start leaking, causing fluid accumulation in the retina, which can cause vision loss. It can also cause massive bleeding in the eye. Sometimes also can lead to retinal detachment, and this can lead to blindness. And there are no warning signs. So most of these eye complications are silent in the early stages. They have no symptoms, and that is why a comprehensive eye examination is only way to detect these eye problems at early stage and timely treatment so we can prevent blindness. Now, you may almost be blind in one eye and not even realize it unless you accidentally close the other eye. Sometimes you may have other diseases like glaucoma, which can slowly reduce your peripheral vision so slowly that you may not be perceive it. So, blindness due to diabetes, which is preventable, can only be detected at an early stage and timely treated if you have a comprehensive eye examination. Now, what is a comprehensive eye examination? Doing refraction for eyeglasses, is it a complete eye checkup? Or checking for cataract, is that a complete eye checkup? The answer is no. Because apart from these routine parameters, we also need to pay special attention to other parameters like the checking your intraocular pressure and doing a detailed retinal examination. Because only with this can we understand about these eye complications. Now, the next question is, when should I get these eye checkups done? So if you are a patient with type 2 diabetes, you should undergo an eye checkup soon after diagnosis. This is because type 2 diabetes diagnosis is often delayed by 2 to 3 years. So the uncontrolled sugars may be already affecting your eye. It was found that about 7% patients had some form of retinopathy at the time of diagnosis. And hence, do your first eye checkup soon after diagnosis and yearly thereafter. What about type 1 patients? Now, in type 1 patient, these complications usually occur after 5 years of diabetes. So they can have the first eye checkup after 5 years and yearly thereafter. But remember, in type 1 patients, once a retinopathy develops, it can progress very fast. So you need to undergo checkups more often. Now, what about other symptoms? If you have any symptoms like pain or redness in your eye, if you have any diminished or blurred vision, any flashes or floaters, you need to contact your eye doctor. Now let's understand the other risk factors of diabetic retinopathy, because once we understand them, we can try and control them to prevent the retinopathy. So the major risk factor is the duration. So the longer the duration of diabetes, higher is the risk of getting retinopathy. So if you suppose you're a diabetic for about 10 years, your risk is about 25%. That is 1 in 4 patients have some form of retinopathy within 10 years of diabetes. This risk increases to about 60%, which is 2 in 3 patients have some form of retinopathy after 20 years. But in patients with type 1, this risk is much higher. That is about 90% patients have some form of retinopathy after 20 to 25 years of diabetes. So what are the other risk factors? So if you have uncontrolled blood pressure, diabetes, uncontrolled cholesterol levels, if you are obese, that is if you have higher weight, if you have any form of kidney disease, and in pregnant patients also this retinopathy progresses very fast. So every diabetic patient should have an eye checkup before conceiving and during pregnancy. Now, let's look at the prevention. So we may not be able to totally prevent the eye complications in diabetes, but you can at least delay the onset and reduce the progression of retinopathy if you control your blood sugar, cholesterol, you control your blood pressure and your weight, and also your kidney disease. And how do you do that? You have to regularly follow up with your physician and do regular diet and do regular exercises. Now, certain form of exercises may not be good for certain kinds of retinopathy like the proliferative retinopathy patients. Like some form of exercises like Kapalbharti where you need to do heavy breathing may not be good for diabetic patients like the retinopathy patients. So, is this exercise safe for you or not? You can ask your ophthalmologist. So, I would like to conclude this session by telling that diabetic retinopathy patients, the blindness can be prevented by an early detection and timely treatment. So, please have a comprehensive eye examination with your ophthalmologist as regularly like you follow up with your physician. Thank you.